trial. Then the preclinical information, a summary of the preclinical information, like about the animal and cell culture study which is done with this product, that will be contained. Not the entire information, the full information, it will be present in your IP. Here the summary, it will be present here. Okay. Then in which animal study was done, which type of the test is done, like that information here it will be present. Then it will be contained about the clinical trial information, like in the phase 0 or in the phase 1 trial, what we done, what is the aim, what we done in that, what is the result which we got. Then from the phase 2 trial related information. So from the previous clinical trial also, what are the information which we collected, that summary also here it will be present. Then summary of the potential non-risk and the benefits in the human subject, that also here it will be contained. Then it will be contained about description about the information about the drug dose information, route of administration, frequency related information, treatment period. So that justification about this also here it will be present. Then after that, in which population, in which indication this study is conducting, about that particular indication related. Like if it is any diabetic study, then that diabetic study related information. Okay. So in which populations we are conducting the study, or in which indications we are conducting the study, about that disease condition. Okay. About that particular disease condition information also here it will be present in the section. Then after that, after this background information, we are going to the other main part. Other main part, it's about the study objective or the study aim. For every trial, there will be a certain aim, there will be a certain objective. So here, what is your aim of your trial? Okay, like suppose if you are conducting a phase 3 trial, then what is the most common thing? Like we are conducting the study to confirm the safety and efficacy of the product, and also there will be a comparison also will be present with a standard treatment or the placebo treatment. So that primary and secondary objective of the trial, what is their aim by conducting the study, what is their objective, that will be present here in the section. Okay, what is the aim of the trial? There will be primary aim, like a main aim will be present, then there will be secondary aims will be present. So all the aim by conducting this study, that will be described here in the section. Okay, so after this it will be contained about the study design. We already studied about the different types of the study design. So can you say some example, what are the different types of the study design? What are the different types? Anyone? There is some different types of the study design we are using in the trial. Anyone? Like blinding, parallel group study, factorial study. Like the different types of the designings are using. No? Parallel studies are using, factorial designs are using, crossover studies are using, use of control groups are present, randomization methods are present, blindings are present. Like the different types of the study designs are used in our trial. So which type of the study designs are using here in our trial, that will be described. So that detailed description about the study designing method, that will be present here in the section. Then they will give a schematic diagram about the study designing method also. Like always the first visit which we are conducting in clinical trial for a trial protocol, that will be the screening visit. So screening visit which is using to conduct the eligibility testing. Okay. So there will be, as per your protocol, there will be a certain duration also for your screening, like that 7 days, 14 days, like that a certain duration also will be present. So they will give the screening visit, then just give like minus 14 days. Okay, then after that they will give a, it's like a flow chart based diagram will be present. Then after that next visit will be present. For example, if it is running, then it will be mentioned running. Okay, so maybe it's for a 1 week, so they will give running in bracket minus 7 days. Then after that next visit they will give like baseline visit or the randomization. Okay, so in that randomization, if two drugs are involved in the trial, usually one group they will get the study drug, second one they will get the comparator drug. So suppose if there are 500 subjects are there, they will, that number also they will give it, like they will give control for like 250, then test for 250, like that number of the subject they will give it. Then after that the treatment duration also they will give. Then after that end of the treatment, then suppose it's a 6 month study, then 24 week, like the treatment duration they will give like 24 weeks. Then near to that they will be mentioned parallel randomized multi-center double blind study, like that information they will give. Then after that 24 weeks end of the treatment, then after that maybe 2 weeks safety follow-up visit, like that a flow chart of the visit activity they will give here in the section. Okay, so a schematic representation of the study design, that is also required to be provided. Then about your drug related information, then the duration of the study, then including in each patient visit. Okay, what are the activities we have to be performed in the visit? Such information also here it will be present, like the sequence of the activity, sequence of the visit which is required in the trial, that will be present, like screening, as I mentioned, running, randomization, then the treatment follow-ups, the end of the treatment, safety follow-up. So in which day the visit need to be performed, including if any window periods are available, that window period details. In each visit, what are the activities are involved in that, all the information here it will be present. Then our study participant, when we included in the trial due to anything, we may discontinue the subject into the trial, maybe subject on choice or otherwise investigator due to anything, they may withdraw the patient, so that reason also should be included. Then how they will maintain the randomization code and confidentiality, then what are the steps which is involved to minimize the risk to the trial subject, is there any possible benefit for the trial participation, related information also we can see here in the sections. Then after that eligibility criteria will be present. So eligibility criteria, we cannot take everyone into the clinical trial, we cannot select all the patients into the clinical trial, there will be certain criteria should be met for this subject. Okay, so that criteria which is inclusion and exclusion criteria. So inclusion and exclusion criteria which is known as eligibility criteria. Okay, so this is not to personally exclude from anyone from the trial. This is to select the exact or the suitable subject into the trial. For that eligibility criteria or the inclusion and exclusion criteria is using. So this inclusion and exclusion criteria which is based on certain factors, like based on the age of the subject, based on the gender of the subject, then stage of the disease condition, then previous medical history of the subject, previous medicine information, then presence or absence of any medical condition, psychological condition, then any allergic condition. Based on these factors, these inclusion and exclusion criteria which is preparing by the sponsor. Okay, for example, age of the subject. Okay, so they may give like greater than or equal to 18 years. Maybe they're mainly less than or equal to also they will give it according to their requirement. Then gender, maybe they will give male, female only. Maybe they will give both male and female, like that they will be present. Then in which indications we are conducting the study, that disease condition it should be diagnosed with. So maybe naive patients they are required in the trial, maybe in a certain duration of the certain length of duration of the disease conditions are required. Like it should be mentioned that the disease condition should be diagnosed at least 1 year. Like that, a certain duration of the disease condition they mention. So that like the information will be present. Then any diagnosis test which will be given for that particular disease condition. For example, for any pulmonology disease condition, respiratory disease condition, pulmonary function test they will mention. So like that, any test information will be present. Or otherwise, for the diabetic condition, HbA1c criteria, fasting blood sugar will be present. Then, like that, in which indications we are conducting the study, according to that, there will be any test method informations will be present. Then also it will be present. Subject should be give their written consent. Voluntary written consent will be there. Like that, some points will be present in your inclusion criteria. Then in your exclusion criteria, if there are any non-allergic cases with your product or any component, then that details will be present. Then maybe any other serious disease condition which happened to the subject recently. For example, any stroke happened within last 2 months, like that, or any heart-related issue which happened in last 1 month. Like that, any certain disease condition happened recently, like that informations will be present. Then any other serious condition like hepatitis or like any serology positive cases, hepatitis or any HIV cases like that, positive result they will be avoided from the trial. Then any abnormality in certain blood test or any urine test, for example, any um, creatine related issue, ALT/AST related issue, HB related issue, like that, any abnormalities in the laboratory parameters will be present. Then oncology related, any cancer related disease conditions subject have, they will be avoided from the trial. Then any previous participation in the clinical trial. So usually they will mention like in a 1 month duration. So like that, any recent participation in the clinical trial. Then mostly the pregnant lactating woman will be not allowed in the trial. So if they will mention that pregnancy, lactating mother will be excluded from the trial. And in case if there anyone who have any childbearing potential, should be used any contraceptive methods. Otherwise, who wish to become pregnant also will be avoided from the trial. Like that, some points will be present in the inclusion and exclusion criteria. So there will be for every trial there will be a different inclusion and exclusion criteria will be present for the selection. So all the subject who give the consent, okay, the subject who wish to participate in the clinical trial, if they are ready, they will give the consent. So once the consent is signed by the subject, and in the consent investigator who done the discussion with the subject, investigator also should be signed. So if this consenting procedure is completed, then only any of the eligibility related test we have to be performed. Okay, so first thing we have to obtain the consent, then only start any trial related activity. Okay, first get the consent, then only start any study related activity. So once the consent is done, then only we can check any eligibility testing. Okay, clear? Is it clear?
Yes, ma'am.
Once the consent is done, then only you can do any eligibility testing. Without the consent, we can't do any activities in the subject. We can't do any procedures in the subject. Then after that, next information, it's about the informed consent procedure form informations will be present, like how to get the consent from the subject, what are the points should be discussed with the subject. So you know that the entire study related informations we have to be discussed with the subject, and while we are taking the consent from the subject, the whatever the study related information which we are sharing, it should be in the language which the subject can understand it properly. Like in the local language should be used for that. Don't use any technical words. The proper explanation should be provided. Then investigators should be provided an opportunity to the subject to ask any study related query if they have any doubts. Then investigators should be provided a consent form to the subject to read it properly. Like that, some instructions will be present. Then LAR, legally acceptable representative, impartial witness, related information also it will be present. In which condition LAR or the impartial witness should be used for the study. Such related informations will be present. If any vulnerable populations or any children are present in the study, that related instructions also here it will be present in the informed consent section. Then after that, it will go for the visit schedule and process. So in the visit schedule and the process, usually it will be contain a table. So here in the table, it will be present. It will be present. A table will be present. So here in the table, it will be contain which are the visit needs to be conducted. And in each visit,